Hello, and here we are continuing on to part 3 of joints, and we're going to talk about what determines movement. So I like these little models that are used in art because it gives you an idea of how does this joint bend and in what direction can it bend and what direction can it not bend. So we're going to be thinking about those things. So really when you think about what determines movement, what are you thinking? One is what's going to matter is the shape of that articulating bone, right? And you've seen a bone like the ulna, which is shaped like a U, and it completely clasps in behind the humerus. So you know that it has that particular shape, or it can just sort of join on there. So the shape is very important. What else? The arrangement of the ligaments in that region. So the ligaments are going to hold that tight, right? And allow it movement in one direction, maybe not in another. So that's important. And then the other thing that's important is the arrangement of the surrounding muscles. So those big muscles might also be an impediment to movement at a particular joint. So all those three things are very important. So let's think more about the vocabulary that we use. You're going to have to really learn this kind of movement you make at some of these synovial joints. So here's a lady, and it's showing lifting up her leg, and she's flexing the lower leg here. And by definition, we say that in a flexion, you're decreasing the angle between the bones. So just see here, this angle that we're talking about here. The more she lifts it, the greater the flexion, the greater the decreasing of the angle between those bones. And in an extension, she's going to bring it back down again, right? And she's going to increase the angle between these two bones. So that's pretty straightforward. And it's defined there. Extension increases angle. Okay, what else? We have flexion, we have extension. And it's just illustrating it again, the flexion and an extension. We have an abduction and an adduction. So one letter changes the entire meaning of this. So abduction is moving away from the midline. And think of it as abducted. Someone was abducted. It means they were taken away. Movement away from the midline, as opposed to adduction, where you're adding towards the midline. Okay? So there is an individual abducting his arms and then adducting his arms. And this is very important when we get to muscles. We're going to be talking about a muscle that's an adductor or an abductor. So very important to get this straight. What else? The other movement is circumduction. I'm going to show you pictures of all these, but you could stick your arm out right now, out straight, laterally beside you, and then rotate, just sort of keeping the palm down. You got your palm down, and then you make circular movements in the air without rotating your palm in any direction. That's circumduction. But I'll show you pictures. Different from rotation, where you have your arm out, palm up, palm down, palm up, palm down. That is rotation. Then we're going to talk about the feet, where you invert or evert. You're pulling your soles in or you're pushing your soles out. And plantar flexion and dorsiflexion. So let's look at pictures of these. Dorsiflexion and plantar flexion. Dorsiflexion is the first one. This direction, dorsi, and plantar flexion the other way. Okay, here the shoulders. The shoulders, we can elevate them as he's bringing it up here, or depress them and bringing it down. Good. You can put your arm out like that. You can be doing this in front of the computer. And you can protract, sort of push away, or retract, like standing up like a military man. Just putting your shoulders way back. That's to retract, and then pushing forward is to protract. The shoulder is very complicated. It does a lot. And the scapula has a lot of movements. So let's look at these scapular movements. They go in pairs of two. So you can elevate, going up, and depress. Up and down. We saw that one. Okay, next pair. Adduct. Look, you're bringing it in like this. And just kind of close up that space between your two scapulae. Or you can protract and bring them further apart. Your arms kind of have to come with that too. It's called abduction or protraction. So adduct and protract. And then the last pair here that we have is upward rotation. So do you notice how this was further this way? And we've rotated it up, so it's this sort of rotation in that direction. Upward rotation, or bring it back down again, downward rotation. Okay? Elevate, depress, adduct, abduct, or protract, and then upward rotation and downward rotation. This is important when we're talking about muscles, and we're going to say, okay, what is the function of this muscle? What does it do? Does it adduct? Does it elevate? Does it downward rotate? That's where this is going to be important. I do have a video posted for you on shoulder movement, but let's look at the difference between circumduction and lateral rotation. So here I'm showing you circumduction. I was trying to show that to you. It's kind of like a triangle like this, a cone, right? When you're just rotating in the air in a cone fashion. And here, lateral rotation is different. It's just opening up that arm and then closing it back down again. So that's a rotation. This is a circumduction. The circumduction, look for the cone, and that's how you're going to tell. Also, the supinate and pronate is a rotation. Okay, back to the foot again. We have dorsiflexion up, plantar flexion down. So ballerina, plantar flexion. And this is for the soles that I was showing you. You invert, you kind of bring your soles together towards the inside. I don't know how else to explain that. And evert, you're sort of shaping them out. Invert and evert your feet. And I think that was all of them. Okay, in classifying synovial joints, they could be a hinge. And a hinge joint is one that permits movement in a single plane. Think of how a hinge works on your door, a door hinge. You know, it can open and close, but it can't go up and down, correct? Hinge joint. Your elbow and your knee can do that. They have one plane. It's only allowed to move in one plane. If it moves in a different plane, you know something's terribly wrong. Your finger joints. And they're often, you'll see in textbooks, online, compared to some sort of hardware from Ace Hardware, where here you have the humerus and the ulna, and they fit so well together. It's kind of like a piece of hardware like this, where you have that really nice angular movement, but just in one plane. It cannot go laterally. Very effective. Gliding joints. Gliding joints are the joints that you have in your carpals. So those bones, little square bones side by side, and they will sort of glide a tiny bit in one direction, you know, kind of north-south or east-west, right? It's showing you here how they can glide in more than one direction. What it takes is for those bones to have some sort of flattened surface. It could be a little curved, but mostly sort of flat surfaces. And the movement can be in any direction, and it's usually limited to the ligaments that are in that region. So people who say they're double jointed is because there's weaker ligaments, and they allow for greater movement of joints like gliding joints. So this illustration is of the carpals, but the tarsals would work the same way. Okay, what else? A pivot joint. What's that? And can you imagine one? What part of the body would have a pivot, place where you can pivot two bones? It's going to permit rotation, And usually one bone has a projection that fits into the ligament of another bone so that they don't fall off each other. And the really good example of that is the atlas and the axis. C1, C2. So remember the dens or the odontoid process? And the atlas is going to then rotate. So it's this rotational movement that is so great that allows you to say no between C1 and C2. It's a pivot joint, difficult joint. Masters of engineering, this human body. Okay, next, ellipsoid joint. Now this doesn't sound like anything, right? You need something that's sort of ellipsoid, and we're going to look at metacarpal bones and phalanx. So where your hand meets your finger, we have a condylar joint. It's called metacarpal phalangeal because it's the metacarpal onto the phalanges. And see, this isn't round, it's more like an ellipse. So it's some sort of oval surface that meets with a depression on the other one. It's fantastic, right? That you have one that's curved one way and the other, one's concave and one's convex, and they can sit in there and form a perfect little joint. Now the interesting thing is this can move in this direction, but it can also slightly move up and down within this little depression. Very sophisticated joint that you have on your knuckles, right? So look at your hand right now and see what movement is allowed from your hand to your fingers. You can flex your fingers and then you can move your fingers sideways also. So it's more than one direction that you're able to move that. So if anyone watching your house thinks that you're crazy because you're looking at your hand right now, just go ahead and do it. Flex over the palm and then shift your fingers side laterally and see how that is a complicated joint. Okay, another type of joint, not ellipsoid, it's called saddle, a saddle joint. And this is where you have two curvatures. Before we had convex and concave, and now it's like having two concaves together. And this is your metacarpal coming up on your thumb, your metacarpal coming into your wrist. That is a saddle joint. Again, that gives a lot of pain to some people who have, loss of cartilage in that joint. Saddle. It's metacarpal 1 in the trapezium, remember? That's the first carpal bone. And it allows a ton of movement. So again, you're going to be instead of staring at your computer, you're going to be looking at your hand now. And palm up and get your finger. And what kind of movement can it do? It can rotate, right? Circumduction. It can come across and land on the palm of your hand. Or it can abduct. So it has so much movement, the thumb, that to do that, you need a very complicated saddle joint. This is why you have an opposable thumb, because you have that joint that allows it to move in so many directions. Are you finding this amazing? Because it is amazing. Okay, ball and socket. This one you know. You have a round head and a cup-shaped depression, right? It's your shoulder, it's your hip, and it's an amazing joint that allows for so much rotation in that location, circumduction, adduction, abduction, elevation, so much. There's a really nice video that shows you how all these different joints work, so I'll direct you there. Make sure you look at that. So this is another nice example here where you have a flat surface on a flat surface, like the clavicle on the manubrium here. You know, that doesn't have a whole lot of movement, but it does slide a little bit in either direction. And the other ones we looked at already. Just nice examples. Okay, let's look at some pathology. That's how we sort of end some of these chapters, looking at the pathology. Joints do have their problems. You can have inflammation of joints, osteoarthritis, rheumatoid arthritis. So let's look at those. And this is an example of arthritis here where the this corroding, this cartilage is worn. And then you're going to have nerve, bone on bone, nerve stuck in between there. It's a lot of pain. So let's take one at a time. Here is a joint that's normal. It has its cartilage. It's coming into the pelvis here. And this one has osteoarthritis. So there's wearing of that cartilage. And then it's created abrasion on the bone, and the bone starts to deposit more bone. So now you have what used to be smooth. You have, eroding here of that cartilage and deposition of more bone. That creates pain. Osteoarthritis is just the regular old wear and tear. We're living for longer. We live into our 90s now. Lots of people do. And it just wears down. That cartilage can wear down and create an abrasion on the bone here. There's some bone spurs. They can break off and just be floating around. So this all has to do with that irritation of the bone that's no longer cushioned. More pictures of osteoarthritis. So cartilage, and here we have the synovial membrane. Synovial fluid is in there. But we could have then bone spurs, because this is too close together. You don't have the space that you're seeing here. Do you notice? And then there could be pieces of cartilage that are floating around in there. All sorts of things can start happening in that once healthy joint. Now, I want to make a big distinction between that and rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder. It's a disorder where you create antibodies against that joint. So you're starting to break down that cartilage, break down that bone. So there's hypertrophy, okay, not just breaking down, but this synovial membrane gets inflamed. So look at, I'm going to take you back to the other one, which was normal up here. And now I'm going to bring you back, and you have this inflamed synovial membrane. You've diminished the space that you had here, cushioning. You get the joint capsule. Let's go back and look at how it was before it was swollen. Smaller joint capsule. Now it's enlarged. You have bone destruction, cartilage destruction, and abnormal bone remodeling. So when you push on that bone, it starts to remodel. And this can really deform some of the fingers of the hand or toes. It's a difficult disease. So this is some, alarming pictures of what could be happening at the level of these joints. Very scary. And that's all I'm going to say about rheumatoid arthritis. There's a lot of medications now that are trying to target rheumatoid arthritis to diminish this kind of deforming of the hand. Now we're almost there, coming up to 20 minutes, so I'll try and finish this. You hear of a disorder called the slipped disc. Nothing really slipped. What happens is that this intervertebral disc that this is a normal one, should maintain its shape, will bulge. And if it bulges into this area in the intervertebral foramen where there's a nerve coming out, and now it's touching that nerve, that's going to be very painful. This is from a different angle of that, where you have that distortion here, pushing on the nerve. The nerve should have free access, and instead it's getting impinged there. So everything down from here is going to be painful. This is dissected out, so inside, here, let me show you. I'm going to backtrack again for you to see. So this intervertebral disc is intact like that, but if I were to cut it, the center portion is called the nucleus pulposus, and that has sort of a fatty substance that could potentially ooze out and cause this impingement here. So let's say it ends up here. It does get reabsorbed over time, but while this is happening, it's very painful. The correct name is herniated disc. This in the toe, I don't know if you can actually see this here. This is a ganglion cyst. This is bursa that are from the metatarsals onto the toe, and it's become inflamed, and that can be quite painful. And those can be drained. They have excess fluid. They can be drained, and sometimes it resolves itself and it's fine, and other times it will come back. Oh, I tell parents not to do this, not to fling their kids like this. Just hold them under their arms and fling them, because the radius could just pop right out of that annular ligament. And, that's no fun. So it could have a slight tear in it, in that ligament, and then the radius pops out. This is just a review. For you, I think I'm going to cut this off. Retraction and depression. What is this? Retraction, depression, elevation, or protraction? And that was elevation. Okay, and that is the last of the slides. Thanks for listening.